Good morning, everyone. You know they say never meet your heroes. For me, it's the exact opposite. Always meet your heroes. Jen is one of them. I got to be on Jen's show a few weeks ago, and to just see you always show up and bring out such great conversations. Thank you, Jen. Friends, I am really excited to be with you. Again, my name is Vilas, Dhar. I lead the Patrick J. McGovern Foundation. And I am really excited for this panel we're going to have now, because to me it is the natural sort of progression of the day. We started with some observations about trust really as kind of a macro thing, the dreams that we have, the ways that we think about a world in which trust potentially could do great things and without it might lead to darker futures. We got to hear the macro. How do the facts fit in? Where does the research tell us people are today? But now we get to ask the question that I love more than anything else, which is, if we have observed and we have seen, if we have envisioned and imagined, how do we do? What is the actual work of building trust? Because we know that trust doesn't sit in strategy papers, it doesn't sit in PowerPoint decks. It's the day-to-day work of engaging with communities, of understanding, of living with empathy, of building structures that take that and turn into action. There's a great quote from a very wonderful thinker, Rebecca Solnit, who says, "Hope is not a lottery ticket that you clutch on the couch feeling lucky. Hope is an axe you use to break down doors, and hope propels you through those doors to do great things." So in this conversation, we've got some amazing people who are building new mechanisms and structures for hope, for trust. We'll talk about that together. But as we do, I'm going to encourage you all to think about three things. One is to look not just for the inspiration of the stories, but to look for the patterns. What can we lift from these stories about how we do trust at scale? The second, maybe more provocative and to me much more fun, I want you to listen for the tensions. This isn't the work of simply saying we're going to go do something great and everybody's going to get on board. It's sometimes hard and dirty work. It requires unlikely allies. It requires sometimes compromises, maybe not in our values, but in our practices. And maybe third, I'll ask everyone to listen and to contribute in our Q&A to recognize that trust is not our outcome, that we need to look to the bigger picture, that trust is a means of creating a transformative vision of the world. But to do that, we have to start from the people who will be a part of that world, both affected by and maybe much more interestingly, architecting it. So with that, I'm super excited for this conversation. I'll ask you each to introduce yourselves, but Charlie, I want to start with you. We had a great conversation that started with a very unique moment. 5:30 in the morning on a dawn with the sun just rising, with gloves, a bucket, and a book. I'm going to start there and then tell us a little bit about what you do.
I want to clarify that this was not us at 5:30 in the morning.
Might be one day, you don't know.
But maybe tomorrow, and maybe some could join us. So my name's Charlie. I lead a funder collaborative called the Trust for Civic Life, and we invest in new forms of civic experience. What's bringing Americans together, and how do we help support and improve our local communities? And as we do that, we're always thinking about, what does membership look like in today's world? What does it look like to be part of an association? And one of the stories and groups that we found so inspiring is a group called F3, and some of you may be familiar with it. It stands for Fitness, Faith, and Fellowship. And F3 is a group of men who come together around this country in a decentralized fashion at 5:30 in the morning. You bring a set of gloves and a bucket. You bring the gloves because you're doing push-ups and workouts in a parking lot, often on gravel or blacktop. And you bring the bucket because the workouts are so hard, you have a proclivity to throw up. So you got to have the buckets keeping it. After you work out with a group of men who also woke up at 5:30 in the morning or earlier, you stand in a circle. And in that circle, they read scripture. They talk about what's happening in their lives. If it's the first time that you've attended an F3 workout, you get a nickname, and you go by that nickname every time that you come back and you join a Slack group. People are coming to this because it's the opportunity, maybe at first blush, to get buff. They're staying, though, because they're finding community. And that community doesn't just work out. If somebody hasn't shown up to a workout for a couple weeks, somebody's going to reach out to you and say, where have you been? Are you okay? What's happening? When you're together in that Slack channel, they're talking about what are service projects we can go do in our community. We're going to host a fundraiser to go support a family in need, or maybe a nonprofit in our community that's doing great work. They're practicing all the aspects of building trust, but the entry point wasn't the on-the-nose aspect that I think we often think about. We didn't come saying, we're going to come and build trust. We're going to come and support democratic norms. They came because they just wanted to work out.
I love this. I'm going to come back to you with a few follow-up questions. But Sixto, I want to come to you next. You work on something that's so fundamental to the fabric of our society, the welfare of children. And in doing so, you sometimes have to figure out complex relationships and new allies. Tell us a bit about your work, and we'll go deeper.
Yeah. So I get to work in foster care, child welfare, and part of our role at Think of Us, a nonprofit, is really connecting the lived experience of people who are impacted by the system to institutional power. For me, I entered foster care as an 11th-month baby. I was adopted at the age of 9, and it was a very abusive adoption. So by 13, I was couch surfing, and I was trying to get back into the system. And unfortunately, the CPS, Child Protective Services, would come, investigate, close, come, investigate, close. And they kept asking this one question, which is, do you feel safe? And as a 13, 14-year-old, I was like, what do you mean? I ain't gonna die today, you know? And what I didn't realize until I came back into the system, because I started to record the abuse, I started to document the abuse, was there was two things that got me back into foster care. Number one was the fact that I had evidence, but that evidence is data, right? So I fell in love with data as a 15-year-old. Number two was the application of that data to understand where the policy was broken. If I would have said, I don't feel safe, it would have triggered another pathway that would have ended up asking a series of different activities to come in. And so for us, what we're doing is collecting the experiences, generating lived experience data, as I like to say, amongst thousands and tens of thousands of people who are impacted by these systems through their story, but then taking those transcripts, taking that research, and actually manipulating it into data sets that then we can say, we start to understand the collective experiences across county lines. We start to understand the collective experiences across states. And that right there, then we have evidence to actually act. We have the understanding that no matter what your political affiliation is, your gender, all of the things that make us us, where is the systemic thing that's causing an experience that puts us in a position to really potentially harm our well-being, our ability to actually thrive?
Sixto, can you take that and make it a little more concrete for us? Give us an example of something like that, where a data-driven insight takes you to that realization.
Yes. A short one? A short example?
Yeah, as you like.
Joking.
I will tell you all, those of you who know me, I said this to the panel immediately before we came on stage, and probably the most anxiety-inducing thing, I said, our teams have worked on a lot of questions. We're throwing them all out. We're going to have a conversation. So
yes.
Indulge us as we go through this. But
No
Sixto,
worries.
please.
But really quickly, we heard from, there was this perception that youth who are aging out of foster care, you turn 18, you turn 21, and you have to be on your own, that we didn't have supportive adults. And so what we did was we went out and we talked to folks, and 205 young people got that data back. We went out and put out a cash grant opportunity to young people and asked them what they were experiencing. 27,000 young people responded, current and former foster youth. For context, there's 400,000 young people who are currently in foster care. And so we took this data, and then we were able to say, okay, how do we visualize it? How do we take it? And then we started to share it. We shared it in an Excel sheet to states, and states said, okay, we're going to design this type of pandemic program. We're going to design this type of strategy to fix our systems. So from a state doing designing a pandemic program to actually sending it to the last administration at the White House, where when the farm bill around SNAP was being negotiated, we just gave them the data that comes from real people's story around food insecurity. And they designed their own strategy as the White House, and then in Congress actually passed the ability to say, you know what, if you age out of foster care, we're gonna give you a work exemption to access SNAP. So you do not have to work while you're in college or while you're working if you aged out.
So, Orriel, I want to come to that other kind of boondoggle of a challenge in American society, healthcare. And I'm just thinking about Sixto's examples here. I know that you do a lot of work that actually takes you across so many different interventions. The capacity to invest capital, to advise policy, to work with people on what kind of this future looks like. I'd love for you to tell us a bit about your work and tell us kind of what's been very difficult about it over the last couple of years.
Yeah, so as the head of policy and advocacy at Morgan Health, we exist in an organization that does not on its first glance have anything to do with healthcare. It's a financial services institution. So the first thing I think day to day is really being clear about the ways in which my experience and perspective can resonate with the work of a financial services organization. There's a lot of work that happens to build strong communities, make sure that we have affordable housing, look at wealth generation and small business creation, think about sustainability and climate. And having come from a career in government, the thing that I also realize is that there is a misperception in both sectors that the other one has it wrong. And this is in no way an edict on either. It's just, I think, an opportunity, particularly in this room, to emphasize some of the reasons why healthcare continues to be broken. This notion of the financial services sector wanting to make investments for strong communities, but not having a clear lens as to how healthcare is the foundation and the cornerstone of a strong community, is both a challenge and a fun opportunity that keeps me going to work every day. For example, until about 6-7 years ago, when the term health equity took over and became the term of art for poor quality, historical disparities across race, ethnicity, geography, et cetera, people were thinking about quality. People were thinking about quality and cost. And what we've seen in the time since then is that there is now research from organizations like Deloitte, organizations like Meharry School of Global Health, where they have assigned a dollar amount and a figure to the inaction on addressing health inequities. What are health inequities? Differences in health outcomes that are driven by unmet social needs. What are unmet social needs? Differences in the ways that our communities are resilient and our ability to access capital to have strong businesses, and our ability to have adequate and affordable housing, and our ability to meet our basic needs through nutrition and other things. So the sort of opportunity to bridge the gap between what is an economic imperative, for example, mental health. Mental health disparities cost the United States upwards of $400 billion a year through lost productivity, through the exacerbation of how other health conditions manifest, and all of those sorts of things. But at a bank, you wouldn't necessarily think that the way in which you help a community design a housing complex or a mixed-use retail development has anything to do with that, the way you encourage certain professions or you put investments into certain swaths of the workforce. So the work that I do, I think at its core, is being a translator of how that economic imperative translates to this country's persistent inability to get past the chasm of our health disparities. It's not just that Medicare and Medicaid are public programs while the majority of Americans get their health insurance through work. It's the fact that we continue to think in silos as opposed to thinking in the communities. My favorite example is you don't go into a grocery store and have to swipe your work badge. You go into the grocery store because it's the one that's in your community. Same thing with a park. So the places where we live, our everyday lives have more bearing on our health, and that's some of the work that I get to lead at Morgan Health. The government part we can talk about a little bit later.
But Orriel, I love this, and if I can kind of reinterpret what you said, one of the things I heard you say is so many of these things often are couched in a very specific kind of language. They're either about health, dignity, equity, and access, sometimes about economic efficiency, productivity, and prosperity, sometimes about political leanings and ideologies. But one of the things I'm hearing you say is those things are actually linked in ways that maybe the language doesn't help us realize, but they're actually often talking about similar outcomes. Does that sound right to you?
They're inexorably linked. And it goes also to the point where in social justice circles, in social welfare circles, we are wedded to our convention, our lexicon, our terminology. And oftentimes you lose someone at hello, just by virtue of the way in which you characterize an issue. And so I grew up in a household where my parents were 24 years apart. One was a minister, one was an educator. I've had to learn how to translate pop culture just for my father to understand, and I think those are sort of my inherent superpowers to understanding. You have to meet people where they are. You have to understand sort of what is the motivating tenet of the person and the organization that I'm trying to convince to do something right now. And I see this often, particularly where I work with the philanthropic parts of the bank. And I hope them to understand why this healthcare startup organization, not-for-profit, is coming and asking for an opportunity in this particular domain of what they fund. And I find a lot of joy getting them to see it, but most people don't have a translator with the type of background that I have. So if I could clone myself and give people a little piece of that, that's what I would do.
All right, so one of these days you're going to explain modern pop culture to me as well. We're going to set that up
Happy
as a
to.
side thing. There's some weird stuff out there I do not understand. But Charlie, I'm going to come to you. This comment about like how do we translate and create shared language, this seems like right at the heart of what you're doing, right? It's like creating new civic fabric to let people get through that. How does it actually work in practice?
Yeah, so in practice at the Trust for Civic Life, we're 17 philanthropies that have pooled funds to invest specifically in new forms of civic engagement in rural regions across this country. A lot of times what we have is we have philanthropy that's operating at a national level who's been given a charge to say, go and rebuild our democracy. Go and create trust across this country. But if you're 2-3 people operating out of an office, how do you know what's happening across the country? And you're operating with, at times, really big conceptual ideas that don't always match the realities of what's happening in a local community. And so for us, the first thing you have to do is you have to go to that community. You have to understand what that lived reality is. You have to really also embrace the idea that as smart as you may be, as good as your strategy may have been developed, you have to trust those local communities to identify the solutions and have the opportunities and the means to be able to solve problems themselves. When we see that happen, when we see that trust given, it also means you have to inherently have a level of risk tolerance that philanthropy was actually designed to do. It is designed to be the highest risk capital in this country. That is its point. But a lot of times, we find ourselves trying to de-risk everything and then ask communities not to make a misstep. That's unrealistic. Of course they're going to make mistakes, and if we don't know how to fix social trust, we don't know how to drive democratic norms, we don't know how that plays out in healthcare or economic prosperity or systems that we may develop in the government, then we got to be comfortable incubating new ideas, letting risks happen, letting failure happen, and supporting those communities and being the solutions. And so as we look at that, we see ourselves as a platform in a lot of regards. We've got philanthropic dollars on one side, we've got local communities doing amazing work on the other, and our job is to facilitate the flow of information, deals, opportunities, and capacity building across that as fast and efficiently as possible, because we think that's one pathway, not the only, towards actually changing some of that data that the folks at Pew showed us today.
I like this as a way of thinking about the systemic change that's necessary, but I'm going to nudge you, as I did last night, to kind of go down to like the actual level of action. So one of the things you've shared with us is, you know, some of these organizations you support are sewing clubs or book clubs. These like things that people do because they have a couple of hours and they want to feel connection. How does that lead to the kind of systemic change that you're talking about?
Yeah, so I think I'll stay high level for 1 second here. When we go and talk to communities and we talk to Americans and residents of this country about what's it mean to be involved in your community, the number one thing that we hear is the opportunities available for them don't meet their needs, interests, or realities of time and experience that they have. So we have like a fundamental market failure. We have this desire to get people involved in their community, and then we're giving them, for the most part, opportunities that they're not really interested in or don't actually match, and there's a lot of reasons why that happens. And then we look at, well, what are they doing? Where do they want to go? So we funded a sewing club. I think some of our funders that participate were like, why are we funding a sewing club? But that sewing club was a place where, in this case, immigrant communities were showing up. They had a safe space to be able to engage in an activity that was culturally relevant to them, to meet other people. And what were they using that sewing club to do? They were sewing clothes often for people who were in need. They were engaging in service activities. They were having to build the democratic skills that we all want to see. How do we make decisions together? They have to speak in public to other groups. They have to work with people who have different backgrounds and experiences. These are all the things that we want to build the skill set across this country to do. Sometimes I think we have this very ideological idea that it has to happen in a very specific way that we as philanthropy, or those of us just more broadly in this field, want it to be. When the reality is we have to listen to those local communities and let them decide, and sometimes it's a men's workout group at 5:30 in the morning. Sometimes it's a sewing club. Sometimes it's going to a music festival that's your entry point into addressing childcare crisis in your community. It could be many different things. We have to change our mindset about where the entry point is in what's possible.
There's an alchemy to this, and I'm kind of hearing it in all of your remarks. There's where do we convene? There's why do we convene? And there's what do we accomplish when we are together? And it seems like sometimes we have conversations about one of those things. What are the new civic spaces? Or what are people solving for in connectivity? And unfortunately, I don't know that we hear so much about this last bit you shared around what is the act of service? What is the point that comes from being together with people who want to be there to do something that matters?
Yeah, maybe just adding one quick point on that is, for those of you who are familiar with the organization More in Common, they released a study just a few weeks ago. Our group at the Trust for Civic Life released one that followed. Theirs is national, ours is looking at local communities. Some of those local communities are represented by folks who are here, like West Virginia Development Hub, Foundation for Appalachian Kentucky, Inovia that's up in northern Idaho and eastern Washington. And inside of that, one key thing comes across. People want to solve a problem. They don't want to just come together. They don't just want to be at a place talking about things. They want to go solve a problem, and they want organizations and outlets that are going to help them do that.
I really appreciate that. Sixto, I want to come to you, and this is maybe where we begin to explore some of these tensions. You work with a set of people who maybe have some of the lowest reasons to trust the world around them, right? They're often at that front line of vulnerability. And you have told us how you are able to bring them into discourse, to share with you what their lived experience is, to build trust. How does it work? What gets people who have experienced sometimes such trauma to actually be willing to believe that in working with you, they can find a better path forward? What do you do to allow that to happen?
Yeah, I think it first starts with the personal choice of hope. When you share some of the most painful experiences in your life around physical abuse, sexual abuse, the emotional abuse, and you think about the folks who share have hope that there could be something different. And so that's why they lean in to say, you know what, I'm going to give you my story as a data set that is literally going to change a policy, a regulation, a funding flow from the federal government down to states. And the reason they get there is because we're very clear about where is their choice or not. You know, you can say X, Y, Z, but let me tell you something, all we get to do is provide recommendations. Or we're going to go ahead and actually be able to co-create with the federal government on X, right? We're going to be able to partner with philanthropy to develop a strategy over the next 4 years. That has resulted in the past in legislation being passed. But in order to do that, one of the most manipulative things that we could do by accident is when we tell communities, we want you to make a choice, we want you to do it, but we do not prepare you to understand the levers of that could be pulled for impact. We do not prepare you to understand what are other folks going through. We convened 20 ambassadors with lived experience, but what we said to them was, you're about to go into the room with the commissioner who's over $11 billion of the $33 billion that funds child welfare. And you're going to work with them for months. But it's not just about your story. I want you to go out and actually listen to other foster youth stories. What's going on? Listen to the fiscal person. We're going to make sure you have access to researchers. We went out, we didn't know if this was going to work. We said, what if we just go ahead and put out a Google form and blast it to 15,000 folks who work in child welfare, all types of folks, and say, submit your idea, and young people are going to read it. And we had 200 submissions from all over the country, from a chief data officer at a state to the young person who happened to see it on social media. And that information went into these rooms to say, what can we change? And one of the things that changed because young people brought it forward was we want to be connected and live with our families. Only 34% of foster youth are actually placed with their kin, relatives, people that they know. And yet we know over 80% can. One of the things that was blocking that is how we license foster parents. And so what if there was an alternative? What if we said, we're going to give auntie, a cousin, a family friend, the ability from day one, the same supports that we gave foster parents. And it was the mobilization of young people, of kin caregivers, and of the advocacy organizations that didn't show up to say, here's what's wrong, but let me come to the table and actually do some co-creation. And that co-creation resulted in regulatory changes that is estimated to shift over $3 billion from traditional foster care to actually supporting every single month kin caregivers, young people's relatives.
That's incredible. I love this, Sixto. We're going to come to the audience for questions, so I hope you'll start thinking about this. But Orriel, I want to come to you first. A lot of what we talk about, I am very much prone to this, to believing in moral certainty, right? I speak about it in that way, I think about it. And yet in questions like the pragmatics of how our healthcare system is built, I'm curious if you can tell us a bit about how things have changed or will change, or how we should think about the right answer in the context of the reasonable one, in the context of shifting political winds, of how we describe some of the efforts that your organization is doing. Where do we find grounding and where do we have to be flexible?
You know, it's so interesting. I think we've heard a lot about sort of the seismic shift that COVID-19 brought into society as a whole, but if you could think about the micro implications for healthcare, we will probably be reeling from that for decades to come. The sort of complexity of the US health system is the biggest, first big elephant in the room. And it is the thing that also allows us to other our fellow neighbors and Americans in a large sense. For example, the first 6 or so months of my current role were spent trying to articulate just the simple fact that health inequities, health disparities are not things that are only found in Medicaid and Medicare. You know, the sort of notion that because it is a public insurance program, it is inferior. So the notion of bringing people to the other side of that was saying, you go to a hospital, in the same example of the grocery store in the park, that is the hospital. In a rural community, that is the only hospital. And it receives all coverage types. And so this idea of thinking that if you do one thing to one side of the health system and it doesn't have bearing on yours is a fallacy. And that coverage piece started with the Affordable Care Act. And so we've been living through 15, 17 years of misperceptions that's based on negativity having a better publicist than the actual truth. Beyond that side of it, we also have this notion of, okay, at least we can always go back to the science. And where are we now? Basic science, known interventions that helped us develop a modern society are now up in question. And it's one of those things where the perception based on something that can go viral will overstate the actual learned advice of a physician, et cetera. It costs $300,000 to create a physician, and they are burning out because they're fighting Google MD every day. These are things that we have to think about as a system when we say, if we're going to bring artificial intelligence, if we're going to democratize access to healthcare data, at its core, our challenge as a society is how do we bring rote literacy to a level where then we can add public health education and literacy to bring everybody back to baseline. We have a lot of work to do, and a lot of that trust is based on experiences that are very valid in terms of how the health system has historically treated certain groups and how people experience the health system. So on the side of society, we have to figure out how we value health as the undercurrent to everything else. And on the health system, they have to have a reckoning and be honest with themselves about ways in which they have exacerbated historical distrust in certain communities particularly, and need to meet the moment such as now. And I know we need to go to questions, so I'll just pause there.
No, amazing, thank you. We do have some time for questions. I think there's a mechanism for this that I'm not familiar with, but somebody's got mics or something. I can't really see the audience either, so. Do we have questions? There we go, please.
Hi, good morning. Whitney Bookman, CEO of Alestra Impact. Thank you all for what you shared this morning. As I was hearing you reflect on the different systems that you are really operating within and thinking about this idea of cross-sector partnerships and the trust that's really needed to do that, I've been doing some of the research in child welfare as well and noticing, given a background in health equity, kind of that intersection of where frontline workers and healthcare sometimes are the connection point to the child welfare system. Curious if you all have been doing any work on, that cross-sector partnership and what trust has been required to kind of reimagine and renegotiate those systems where perhaps healthcare and child welfare can work to keep families together?
Yeah, I mean, at the intersection, like you said, child welfare ends up being the system that people come to when healthcare fails, when housing fails, when there's an education issue. It's usually when a CPS worker knocks on that door and brings folks in. And so I can talk so much about that, but where I want to go is actually this moment that we're living in. You talked about this being a moment where, COVID really shaked things up. But if we're real, right now we're living in probably one of the most biggest transitions to we don't know what. But what we do know, is that there's a convergence of our lives changing forever. We have artificial intelligence that unlocks so much, and yet we also don't know a lot. What we do know is that the systems in place, such as the healthcare system, child welfare, and other systems, there's been a shift with these last 100 days of this administration. And put your political ideology aside, put kind of the evaluation of the decisions aside. What we know to be true, which is facts, is that over 100 days ago, this country looked a certain way in terms of its structure around how government shows up in our lives to do a variety of things, whether it's to support, whether it's to monitor. And today, that's fundamentally different. And what that does, it means that there is a gap and an opportunity to design and to lean in. And so when I'm thinking about what is the partnerships and the cross-partnerships that need to occur, it's not just partnerships. It's actually the co-creation of what comes next. And if we show up every day hyper-focused on our small piece of the pie, we actually miss the opportunity to make this country great. And this is the opportunity and why I felt so driven to come here today, because for me, I feel like we are living in the most prime opportunity to really shift this country. Not because there may be agreement around what happened, but because we know when there is a transition, no matter what that transition is, relationships, a house, your job, you get to create something different. And that's what this moment is, and that's what we have to lean into. And as much as trust, with a capital T, is important, I struggled with this because I was like, there's a lot of people I don't trust, And it is hard to say, you know what, I'm committed to acting in favor of the goal. It's like, when you're supposed to, you got some issues and you need to go to therapy, but you're like, maybe next week. That is a little bit of this moment right now, I think, for us as we go into partnerships, is really thinking through, if you center yourself in that mission, how do you act in favor of that? How are you truly in service to another level that's going to challenge you? And sometimes, yes, the capital T word of trust may not feel like enough to lean in, but the commitment to the people we serve is what we have to center to actually get over that.
And I'll just say, to that specific intersection, there's an example. We think about where healthcare drops off, to your point, that's where CPS picks up. There is a broader recognition that community health workers and social workers are the missing and the disrespected, underappreciated aspect of the health system. They are the bridge. And to this point of what is a community health worker, they are part and parcel, accelerating beyond any other occupation in the healthcare system in terms of trusted occupations. Why? Because they are not clinicians. They listen to people. They're there to actually help you navigate what your day-to-day is. It's very personalized. It's very much so centered around understanding lived experiences. And oftentimes, community health workers come from the background of the communities that they serve. So that authenticity piece that I think you led with, it can't be overstated, which honestly is lacking in the healthcare system. And so there is growing recognition that only the 20% of healthcare spending that we spend is clinical. 80% of it exists outside of the healthcare system. And it's, sort of solutions like community health workers, finding ways to support those careers, support people who want to have that career, support those career paths, support social workers being actually paid their, worth when it comes to being in network with a health insurance company. They're starting to understand and acknowledge those facets. And to a place like child welfare and healthcare, I just have to put a plug out here for the conversation such as now. Medicaid covers the healthcare services of people who are in the foster care system. So when we see these conversations, it's important for all the folks who know to make these connections so that people understand, no, that is not a problem just for XYZ. This is a broader issue, and it's not just what you're being told in terms of convenience. And so digging deeper. So those are the 2 points that I just wanted to raise in response to your question.
Great. Let's see if we can get one more, or maybe have one after that. Go ahead.
Hi, everybody. I'm Steve Larziliere, founder of Stoked. As someone working in the intersection of youth development, community building, and entrepreneurship, I'm curious, someone mentioned levers. What are the most overlooked levers that we can pull at a local level to rebuild trust, change mindsets in under-resourced communities?
That's a really nice question to bring us home. Charlie, do you want to start?
Sure, yeah, so I think as we think about those levers, I think it really starts with things that Sixto, Orriel have all highlighted. It starts with engaging those community members first and foremost and putting them as the priority voice in the process. I think we start so many processes and we go to pull so many levers that are well-intentioned with good purpose, but the ultimate person who feels the impact of that lever last is the community member themselves.
Charlie, I'm going to interrupt you because I know that was a very thoughtful and intelligent statement, and yet I know that underlying that is actually some emotion and lived experience. Yep. Like, tell us what you really think about that. I'm sorry to nudge you, but I think there's a real truth here.
So as my background, I live in Central Oregon right now. If you're familiar with the politics of Central Oregon, it is the confluence of the progressive politics of the west side and the very conservative politics of the east side. We have like 13 counties who have already had county ballots passed to secede and join Idaho. Like, we are deeply polarized, deeply polarized. And so when we think about those levers that we can come and pull, it's almost like people aren't even hearing what's even possible because they are just so pushed to the fringes. But what's interesting in being at the intersection of that is when you actually go and start to talk at the community level about issues that people really care about, like what's driving your day in, day out, the local park, what's happening with traffic, what's going on with affordable housing. Is that affordable housing going to be close enough, we were talking about this earlier, to the hospital so that the people who work there can actually be part of that community? Like, these are the things where all of a sudden everybody agrees. Everything comes together. People are able to start to have productive conversations and start to move towards solutions, and that trust gets built. And so I think that when I talk about that lever being bringing those who are closest to the problem immediately into the solution set, it's not because it sounds nice, which it does, and I think it's become a talking point for many of us in this particular field. It's because it's actually a really effective strategy. And when we don't start there, almost every other lever that we pull is pretty ineffective.
What I'm hearing you say, I'm going to put it in my own words, is there's a lot of glossy 100-page publications out there about how to build trust, and most of them, they don't have an ounce of common sense in them. Let's start with where people are. Let's start with what people care about. Let's start with what unites us in caring about a thing, and then solve that, and then begin to scale it. Does that sound right to you?
Yeah, and maybe just like one very quick anecdote that I think hits on that. We're at this moment, which Sixto was highlighting, which is a unique moment in our history in this country.
More than unique, but go ahead.
Yes, very rare. It's so unique that many academics on this would say it's only happened 3 other times. 250 years ago when this country was founded, Civil War, civil rights. 3 pretty messy moments in our country's history, and we're in the 4th. And why are we in the 4th? Because the system that we live in right now does not meet the needs of its residents. It's not working for us. And so we're going to blow it up. And I'm not super stoked about the way it's being blown up right now. It's not probably the way I would have done it, but I see a lot of people who are pretty excited about the fact that change is actually happening. And the question actually comes to what you highlighted. What are we going to do about it? What are we going to change this into? And so 2 weeks ago, I was in Bristol, Tennessee at the Appalachian Funders Network Conference. Amazing event, incredibly inspiring. And Katie Loudon, who runs West Virginia Development Hub, who's one of our grantees and is in the room today. There she is right up front. She gave this presentation where she put the 2 sides of our situation very clearly. They've worked with local communities across West Virginia. These are some of the most conservative, poorest, challenged counties in the country, not just West Virginia, to work together on a vision for what they want to create, and they secured $800 million in federal grants to go do it. Incredible. Yes. But then those federal grants get frozen. right? And now it's like, so we see that and we say crisis and emergency, and there's some absolute truth to that. What Katie then went on to talk about is the fact that to get to that point, they had mobilized thousands of Americans and residents in these communities, bingo halls, coal miners transitioning to different economies through workforce development programs, solar installations. I mean, these are incredible. This is where I grew up in West Virginia. These are incredibly conservative places who are starting county-wide climate coalitions. There's an incredible asset that's being built because they started locally. And the question that we have is, what are we going to do with it? Are we going to sit here and say it's a crisis, it's an emergency, and there's no opportunity because we're not getting that $800 million back? But are we going to abandon the thousands of people who put their trust in a new way into a process and a set of people to make something different? They're asking for something different. What are we going to go do to help their vision, not ours, their vision come to life? And in philanthropy in particular, private sector as well, we have an incredible opportunity in front of us. Are we going to seize it, or are we going to let it slide by?
Love it.
I know you touched on community. I want to talk about on the systems reform side. You know, this is we've worked with the Obama administration, the Trump administration, Biden administration, and now this administration. And one of the things that I feel like has been secret to being able to move the needle has been that we've decided to intentionally follow and be in service. And how do you do that when you don't trust the person or you don't trust the institution that is doing that? But what we've learned is by saying, you know what, we're going to show up. What do you need? What do you want us to do? We're going to take work off of your plate. And in the process of actually saying, you know what, we're going to do that research for you, we're going to do that policy memo for you, we're going to organize this event for you, we actually get to filtrate a little, don't record this, no, but filtrate a little bit of stuff in that starts to show folks, wow, this is a different way. And in that design of whether it be a convening, a data project, young people coming together, a policy briefing, we get to bring in something that we start to say, this is feels different, but how do we then do that? And then the second way, we do that with our competitors, which sometimes feels harder, and because of how funding flows work, right? And then the last piece is, you know, we can publish a lot of our research and we can take our data. We have the largest lived experience data set around those who are currently formally in foster care. And yet, sometimes some of the most powerful things that we have done is package that data up in an Excel sheet for you to do your own interpretation, right? And say, I hope to God that, you know, we get to a similar place. And every single time, no matter the ideology, no matter the background, you know, it has landed at a place where I'm like, okay, that's 60 to 70% of what we would have wanted, and being okay with that.
Orriel, 30 seconds of closing thoughts before I get hooked off stage with a giant cane.
Just, I think the common thing that I'm hearing is the sort of empirical information from the communities that you want to build trust with. And one of the places that the healthcare system has failed spectacularly has been sort of putting upon populations. And in some of the work that I'm leading now, I fought for the resources to be able to go into the markets, to engage the employees that we want to figure out and go beyond the data and ask some qualitative information around how do you get from point A to point B? How do you decide to go to an ED versus wait for your primary care clinician? How do you feel when you go to this hospital versus that one? And that automatically gave the project that I'm working on now credibility that other initiatives have not had. So I cannot overstate how important it is for us to leave our glass houses, leave Washington, D.C., and go and talk to people and let them see you as a human who has a heart, but also don't do it quickly and come out. Have some stickiness with the populations.
Love it. So I think you all see why I was so excited for this panel. If the morning showed us that maybe what we're doing today isn't getting us to a great place, the only logical conclusion is we need to do more and different. And we've got 3 incredible leaders up here that are doing some pretty incredible things with Tom and Dan and so many in the room that are modeling this for us. I think the question for all of us becomes, well, if something new is needed, if we believe this is a moment for moral courage, for clarity in the work we do, then what are the actual practices we take into our life to do it? And all 3 of you have shared some really great examples. So thank you all very much, and thank you. I'm excited for the rest of the day.
Thank you, Dhar.